Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. In our previous session, as we have started discussing about the total parenteral nutrition, we've come to know that this is a method which is used to provide the essential nutrients through the central vein, right? We've also come to know that this is a method which is widely adopted for those patients who have had a weight loss of 10% of their ideal weight. For those who are unable to take oral food and fluids within 7 days of post-surgery, as well as for those who are under the hypercatabolic situation. So in that session, we've also discussed about the components of the TPN solution, about the candidates for the total parenteral nutrition, as well as about the various points that we nurses must keep in mind before we provide this TPN feeding to the patient. In today's session, we will be discussing about the administration of the total parenteral nutrition. Before you administer the total parenteral nutrition, as a nurse, you must first assess their vital signs, their electrolyte, their triglyceride level, as well as their glucose level. Then you must also check their weight, their fluid intake and output, as well as the lab reports, because here if there is any rapid changes in any value, this must be noted. And then we must always identify if there is presence of any signs of infection at the early stage. And how can we do this? By being aware of the patient body temperature. Because here usually whenever a person is infected by any infection, then their temperature will always be above the normal level. So here, just by being aware of their temperature and if any changes is occurring in their body temperature or not, we will be getting an idea that the patient might be infected. And since this is a procedure in which the essential nutrients will be provided through the central vein, we must always use the aseptic technique whenever we are caring for the central venous catheter as well as for the PICC line. We must not use the TPN solution if it is not properly mixed or blend, because here, as I've said, that before you provide any feeding, you must make sure that you blend it well, that you mix it well. So here, if the TPN solution is not mixed, we should not use it. And how can we identify this? We can do it by seeing the formation of a thick dense layer of fat droplets on its surface. So here, once you see this, you will be getting an idea that the TPN solution is not mixed. So here you must properly mix it before you administer. And also, if the solution appears abnormal in any way, then you can request a replacement from the pharmacy. And if the infusion has been delayed for whatsoever reason, you must never try to catch up for that delayed infusion. That is, suppose now if the solution which was to be provided to the patient at that particular time is delayed, you must not increase the flow rate just to catch up to this delayed infusion. Here, at the flow rate which will be ordered by the physician must always be followed. So even if the infusion has been delayed, the flow rate must never be increased. So as a nurse, these are few of the things that you must do before you start administering the total parenteral nutrition. So after all of these things has been assessed and checked, then only you can start with this procedure. And as each and every procedure has various steps to be followed, even here the first step that you need to do is you must review the physician order. So here, by doing this, you will be able to compare the medical advice record with the content label of the TPN solution bag, as well as you will be getting an idea of the flow rate which is required for the infusion. And each component which will be present in this TPN solution must be verified first by the physician before you administer it. So why do we do this? Why do we need to compare the MAR to the label solution on the TPN solution bag? And why is it necessary that every component which is there in the TPN solution bag must be first verified by the physician? We do this in order to prevent any medical error. So while you are preparing the solution, the necessary medications which was prescribed by the physician may also be added, as well as you must also assess the central venous catheter as well as the WBC of the patient, and you should also assess the condition of the patient, whether it's active or is hemolyzed. Also here, each and every time a new TPN bag is initiated, the rate of infusion must always be reviewed, because here the doctor may change the rate of infusion depending on the condition of the patient. So after you have reviewed the physician order and after you have got a clear idea of what are the components that must be present in the TPN solution bag as well as the rate of infusion, then you must start collecting all the supplies. You must start preparing the TPN solution. Generally, a new tubing is always required every 24 hours in order to prevent the catheter-related bacteremia. But this can also differ depending on the agency protocol. So here, depending on the protocol which an agency has for a particular institution, you must make sure that this TPN tubing must also be changed accordingly. And while priming the IV tubing with the filter, we must make sure that we do it correctly in order to prevent air embolism. So here, after this is done, you must perform the hand hygiene in order to prevent the spread of microorganism. You must then identify the patient, because correct identification of the patient is very important before you perform any procedure to them. And then compare the MAR to the wristband, and then finally explain them the procedure. Here, why do we explain? We do it in order to enhance their cooperation as well as their understanding. Then we must complete all the safety check for CVC as per the agency protocol, because by doing this, it helps to adhere to the safety policy which is related to the central line care. And here, whenever you need to change the TPN solution, you must first pause the infusion pump, and then you must remove the old TPN administration set. After this is done, you can disinfect the connection and then change the IV tubing as per the agency policy, because here, as I've said, that changing the IV tubing after every 24 hours helps to prevent the catheter-related bacteremia. So here, depending on the agency policy, you must make sure that you change it accordingly. And if you are starting the TPN solution for the first time, then you must first flush and disinfect the CVC lumen as per the agency policy. So why do we do this? We do this in order to prevent the development of infections. So here, whenever we are providing this TPN solution, as well as whenever we are changing the tube, we must make sure that we always follow the aseptic technique, especially for those patients with high dextrose solution, because they are at a high risk of developing infections. And once this is done, you can then insert the new TPN solution and the IV tubing to the IV pump, because here the IV pump must be used with all the TPN administration. You can then start the TPN administration, and here, when you are doing this, you must make sure that you start the TPN infusion rate as per the physician order in order to prevent any medication error. And then you must discard all the O supplies as per the agency policy and then perform the hand washing, because in this manner, it will help to prevent the spread of microorganism. So these are the various steps you need to follow whenever you are administering the total parenteral nutrition. However, your responsibilities does not end here. You still need to monitor for signs and symptoms of complication which can be related to the total parenteral nutrition, because here each and every procedure has its own complication. Just like that, even this total parenteral nutrition also has certain complication which can occur. After you have provided this administration, you must make sure that you observe, so that if there is presence of any complication, this can be noted and notified to the physician. You must also complete the daily assessment and monitoring of the patient on the total parenteral nutrition as per the agency policy. And as I've said, that flow rate is also very important here. So this flow rate must be monitored each and every hour. And once this is done, then you can document the procedure in the patient chart as per the agency policy. Here, while documenting, we must note the time on which this TPN bag was hung, the number of bag, the rate of infusion, the assessment of the CVS site, as well as the verification of the patency, status of dressing, vital signs, their weight, their client tolerance to the TPN, the client response to the therapy, as well as their understanding on the instruction which was provided to them. So here, these are the various steps as well as the various things that a nurse must do whenever she is performing the administration of the total parenteral nutrition. Now we have come to the end of this topic, whereby in today's session we have discussed about the total parenteral nutrition as well as the administration of the total parenteral nutrition. I'll be meeting you in my next session, whereby we will be dealing with the complications which is related to the total parenteral nutrition. So until then, have a good day. Thank you.